Okay, so magic latch. There's nothing magic about it, but when it works, it's magic. So clearly your newborn is not going to have a body posture like this. Might be a little bit bigger than this, but this will have to do for now. The all of the joy of breastfeeding is based on not having any pain and your baby swallowing and doing well. So that starts with the way that the baby comes to the breast. So before you even think about the mechanics of all of that, think about the concept of what your body does when you are drinking, when you are putting liquid into your mouth. If you brought the cup straight into your face, you'd have to somehow go down to get the liquid. So if we bring a breast straight into the baby's mouth, then they have to dip their head down to get it. If we bring a baby to the breast this direction, then again, we're asking the baby to go down for the liquid. If we tuck their arm, because their little hands are going to be right here, because their little hands were right here the whole time they had hands, because this is how we comfort ourselves. So your job, your 50%, is to have the hands where they're going to be the most useful. A lot of people want to put the arm down this direction so that the baby is not having the hand in the mouth, but when we do that, we're asking him to nurse over his shoulder. Also not ergonomically going to be helpful. So we want to have the baby's body in the position where he can drink. His head is unencumbered, can bend back, his arms are where he wants them, bent and near his face, but not in his mouth. Then you have this nice drinking posture here, and the baby's able to do drinking at the breast. You see how my hand is not moved from underneath my breast? This keeps the breast in front of the baby. If I let go, the breast is going to fall, and he has no choice but to follow it down because he can't put it back up where he needs it. So that hurts. So in order to keep him back here, it's helpful if you keep the breast where he does not have to work or torque his body to go get it. Not always. This doesn't last forever, just for the first few weeks. If you can do some of that work for him, that's really going to help. The feedings are shorter, they're more effective, and less painful. So that all sounds good, does it not? So if your hand is here, two things happen. He doesn't have to go find the breast, and you can do what's called alternate massage, which means you're going to alternate with him. If he's sucking and gulping, then you're good, just keeping your hand underneath the breast. If he stops, give him just a second. He might just be catching his breath and kind of getting reorganized. So just sort of start reading that. But if he starts to fall asleep, or if he acts like he's getting frustrated and he's going to come off the breast, if you'll just squeeze your fingers and thumb together, just compress the breast a little bit, you'll push the milk down to him. So that again does some of the work for him, makes things go a little better, a little less battling, a little more milk. So if you're compressing when he's not sucking, he will start to suck again. This is a great trick for a sleepy baby. You can do some of the work, you can help push the milk down. Later, when you can let go of the breast, you can work from the inside. But here in the beginning, just deeply squeeze. Again, you notice I'm not close to where his latch is. I'm way back here so that his latch is not interfered with my movements. But this should help him keep going. This is helpful for drinking. So then you need a lactation consultant to assess the mouth. You need your pediatrician to assess the mouth. Do we have full movement of the tongue? Do we have full movement of the lip? Does the chin significantly recede back so that all we can do is chomp? What's going on with this baby's face? What's going on with this baby's mouth? The whole structure of the baby. That's where you would need some expert help and somebody that could really assess the baby's 50%, because how the latch looks from the outside is only your 50%. So if this is happening and it's still hurting, do not accept the notion that everything's great because it looks great. The other 50% is inside here. So we can help with that. If you are viewing this online and don't have access to an IVCLC or an RLC in your area, seek one out, because they're the ones that can really help with what's going on with the latch if there are problems. So that's our Magic Newborn Latch.